More than 40 million Americans provide at-home care for chronically ill or disabled relatives, according to a recent report. So when this care includes more complex elements of nursing, such as managing medications and wound care, how do these millions of non-professional caregivers know what to do? Joining us to discuss is WSJ Informed Patient columnist Laura Landro. Laura, thanks so much for being with us.
I'm in.
Laura, how intimidating is this, having to give sophisticated medical care if you've never been trained?
Well, obviously, it's really hard. And I think some of the things that people have to do, there's a huge squeamish factor, as one of the people I talked to. You may have to put a needle into someone. You may have to change a wound dressing after surgery. And that, for a non-medical professional, without instruction and preparation for what you're in for, that can be really, really taxing.
Absolutely. And I would imagine there is a huge learning curve here, that people don't know what they don't know until they're confronted with it, correct?
Yes, no, absolutely. And I think there's a recognition of that. AARP did a survey a few years ago now, which looked at the magnitude of this and basically found that so many people were doing this. I think something like half of people of those 43 million or so caregivers, half of them have to do serious medical tasks. And the people who are doing medical tasks are doing some of those things we're talking about: wound care, intravenous fluids, injections.
Now, Laura, why is this becoming more of a trend? Is it a combination of the aging population and trends in hospitals?
Yes, very much so. Obviously, we've got these baby boomers with a lot of complex chronic diseases, often multiple ones. And hospital discharges now, you used to stay in the hospital for a week or more with some of these things. And nowadays, they get you out of the hospital as soon as they can as a cost-saving measure. Sometimes they want not to expose people to infections in hospitals. But basically, lengths of stay in hospitals have shortened and people are going home, even otherwise healthy people, with surgical wound dressings and IVs and pumps that people have to figure out. And then there are other people, you think, oh, well, if you're sick and elderly at home, you get a lot of home care, but you really don't. It's actually fairly limited, the amount of home care that people get, and a lot of people can't afford some of the private duty things.
So what are some of the ways then, Laura, that people are preparing themselves for this? Are hospitals and healthcare professionals helping to teach caregivers what they need to know?
Well, that's going to be coming up soon, because there's a law that's been enacted in 31 states that basically will require hospitals to help people with this, to give them the opportunity when they're being discharged to more carefully plan, demonstrate, and have perhaps a helpline, something like that. And it's called the CARE law. And as I said, 31 states have already enacted it, territories. And it's basically something that will give you some help. There are also some private nonprofits jumping into this. AARP is working with the Betty Irene Moore School of Nursing at UC Davis, and they've developed some really good videos, which are going to be free online.
Oh, that makes
and
great
the
sense.
Family Caregiver Alliance as well has done those. So there's some good video out there. You can go online, go to your computer, stop and start. There's courses being developed online by some of these groups. So definitely help is on the way.
It's clearly a growing need for this. But how dangerous is it, Laura? Are there dangers that we should be looking out for if we find ourselves in this situation?
Well, yeah. I mean, one of the women I spoke to who provides a lot of care says, look, frankly, I've hurt my daughter who I've been caring for. I've hurt my mother-in-law. Another woman who was helping someone getting out of shower, they fell. They fell together. So this can happen, but mistakes can happen. You can be harmed in the hospital too. The idea is a loved one is caring for you. It's going to be touch and go a little bit. But basically, these are things, as the dean of the nursing school told me, you can learn this. People can be trained to do this.
Sounds like it will become the new normal as well.
Yes.
Laura, thank you so much for that.
Thank you.